Most people with sciatica are told that once a disc is involved, surgery is only a matter of time. But that belief is often based on missing information. In our clinic, we've helped thousands of patients recover quickly from sciatica leg pain and disc injuries like L4-L5 bulges and L5-S1 herniations without surgery by following a very specific process. In this video, I'll walk you through our 5-step treatment approach designed to correct the underlying structural causes of sciatica so leg pain doesn't keep coming back. If you want to know whether surgery is truly your last option or if there's still a smarter path forward, this video can give you clarity. Keep watching because I'll also share the story of one of our patients who was headed towards surgery and how the same 5-step approach helped him avoid that and get his life back. Hi, I'm Dr. Cordova, a chiropractor in Houston, Texas, with 29 years of experience helping people with chronic neck pain, back pain, poor posture, and sciatica nerve irritation. As a chiropractor, I believe the adjustment is the most powerful thing we do, and being specific with it matters, which is why I rely on spinal x-rays to guide every patient's care. On this channel, you'll get simple, specific, and safe strategies you can use at home to feel better fast. I share the same x-ray guided chiropractic strategies, posture fixes, and modern therapy insights I use in my clinic to help patients get long-lasting relief. Subscribe to learn how to take care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. If you've been dealing with sciatica leg pain for months or even years, you've probably already tried stretching, injections, rest, medications, or even chiropractic care that help temporarily but never really stuck. That cycle is exhausting, and it can start to feel like your body just isn't capable of healing. The truth is, this usually has nothing to do with effort, discipline, or waiting too long. Most treatments fail because they are applied without fully understanding what is mechanically causing the sciatic nerve to stay irritated. Sciatica is not just pain. It is a signal that something structural is repeatedly stressing that nerve, often in ways that are easy to miss. When care focuses only on calming symptoms instead of correcting the cause, relief fades and the pain comes back. That is why so many people are told surgery is the next step, even when they don't feel comfortable going that route. Today, you're going to learn a different way to look at sciatica. I'll walk you through a proven 5-step approach we've used with thousands of patients to help resolve sciatica leg pain and disc injuries without surgery. This approach also addresses one key, commonly overlooked factor that, when present, keeps sciatica from healing no matter what else you try. Let's start with step 1 because everything else depends on it. After a thorough consultation and examination, the first thing we do is take full spine x-rays, and there's a very specific reason for that. With sciatica, we are especially focused on the alignment of the lower lumbar spine, particularly the L4-L5 and L5-S1 segments, along with the position of the sacrum and the pelvis. These areas matter because they absorb the weight and load of the entire upper body. Even small misalignments here can place constant stress on the nerves that form the sciatic nerve. What many people don't realize is the problems in the lower back often don't start there. Global misalignments higher up in the spine can shift how force travels downward, overloading the lowest segments over time. If the pelvis is tilted, the sacrum is rotated, or the lumbar spine is out of balance, the body keeps compensating until the nerves and discs can't tolerate it anymore. These x-rays are not just for diagnosis. We use them to guide every part of the treatment and care plan. There is no guesswork. We can see the structural problem and address it at the root by correcting misalignments, reducing disc pressure and nerve compression, and supporting healing with modern therapies that calm inflammation at the cellular level. Stay with me because later I'll share a patient story where this exact process helps someone avoid surgery entirely. But first, let's talk about one of the most overlooked contributors to sciatica that almost no one checks for: a leg length discrepancy. When our neutral lumbar and pelvic x-rays suggest that there may be a leg length discrepancy, we take the next critical step, which is to confirm it with a full leg x-ray. This allows us to determine whether someone has a true anatomical short leg, not a functional imbalance that comes and goes, but an actual difference in bone length. This assessment is crucial, and it is one of the most commonly missed evaluations in chiropractic offices, physical therapy clinics, and even by medical doctors and specialists. When one leg is shorter than the other, the sacrum and pelvis are forced to tilt. And remember, the entire spine sits on the sacrum. Think of the sacrum as the foundation of the spine, and the legs are the pillars supporting it. If those pillars are uneven, the foundation tilts, and the spine has no choice but to shift and compensate. Because anatomical leg length differences develop during childhood and do not change in adulthood, that imbalance stays with you for life unless it is addressed. Over time, this constant tilt can overload the L4, L5, and L5-S1 discs, leading to nerve compression that causes chronic sciatica leg pain. This is why leg length discrepancy is such an easy but critical cause to miss. We measure it precisely to the millimeter using full leg length x-rays and correct it with a custom foot lift that levels the legs, the sacrum, and the spine. For many patients, this step alone creates a dramatic improvement in long-standing leg pain. Once we've identified where the misalignments are, both locally at L4, L5 or the sacrum, and globally throughout the spine, the next step is to correct them with specific chiropractic adjustments guided by the very x-rays we took. We keep those images on hand in the patient's file and use them as a roadmap, so every adjustment is intentional and precise, not based on feel or guesswork. The result is a targeted correction of spinal misalignments that restores proper joint motion and reduces abnormal stress on the discs and the nerves. These adjustments are gentle and safe, even for patients dealing with severe sciatica leg pain, because they are customized to the individual's structure and condition. Nothing is forced and nothing is random. This step is critical because it directly addresses where sciatica began. When the L4, L5, or S1 spinal segments are not moving or positioned correctly, the nerve roots in those areas stay irritated and compressed. By improving alignment and motion at those exact levels, pressure on the nerves decreases. Inflammation begins to calm, and the body finally has the opportunity to heal. This is where many patients start to notice real, lasting changes instead of short-term relief. Once spinal alignment is improving, we introduce non-surgical spinal decompression, and this step is especially important when sciatica is being driven by a disc bulge or disc herniation. Chiropractic adjustments help restore motion and balance, but decompression directly targets the disc itself, which is often the structure that's pressing on the nerve. Non-surgical spinal decompression works by gently and precisely reducing pressure within the disc space. This creates a negative pressure effect that allows the bulged or herniated disc material to retract away from the nerve root. At the L4, L5, and L5 S1 levels, this matters because these discs sit directly next to the nerves that form the sciatic nerve. When pressure on the L4, L5, or S1 nerve root is reduced, leg pain, tingling, and numbness can begin to calm. What makes this treatment effective is that it is controlled and targeted. The decompression is tailored to the specific disc levels involved rather than applying the same traction to everyone. Patients consistently tell us how comfortable it feels, and many notice a reduction in sciatica leg pain even after the first few sessions. This step not only relieves pressure, but also sets the stage for the disc to heal properly, which is essential for long-term results. Step number 5 focuses on something most sciatica treatments completely ignore, and that is the healing environment inside the body. Even after pressure is reduced and alignment improves, disc injuries and irritated nerves still need time and the right conditions to heal. That's where PEMF, or pulsed electromagnetic field therapy, becomes a powerful and unique part of the plan. PEMF therapy works at the cellular level. It uses low-frequency electromagnetic signals to support cellular energy production, improve circulation, and reduce inflammation. Disc tissue has a very limited blood supply, which is one of the main reasons disc bulges and herniations heal slowly. PEMF helps stimulate cellular repair processes in these low healing areas, supporting disc recovery while calming inflammation around the affected nerve roots. When sciatica leg pain is caused by irritation or compression of the L4, L5, or S1 nerve roots, inflammation plays a major role in how intense and persistent the pain feels. PEMF helps quiet that inflammatory response, which can significantly reduce pain signals traveling down the leg. This is very different from approaches that only mask pain or rely solely on mechanical correction. Patients love this step because it is comfortable, relaxing, and often leads to faster relief. When combined with alignment correction and decompression, PEMF helps lock in the results and support long-term healing instead of temporary improvement. And to show you what this looks like in real life, let me share a patient success story. So let me tell you about Thomas. Thomas is a pastor. He has 3 young children. He had been dealing with sciatica off and on for years. Usually once or twice a year, it would flare up, leaving him unable to move. He had had MRIs, he had done ibuprofen, he'd been to his medical doctor for stronger prescription medications and injections. He had tried stretches he watched on YouTube, exercises, but so far nothing had changed. Now, when he came to see me, his biggest issue was not just that he could not deliver his sermons, but that he was unable to get on the floor and play with his kids or even do things like play catch with his kids. When we saw Thomas, he was clearly in pain. He was leaning off to one side because that sciatica leg pain was so far down his leg, he was unable to move. After a thorough evaluation, we did the consultation exam and x-rays. We got started. He told me he was terrified of getting adjusted, He was worried that it would hurt worse, that it wasn't going to help, and he was going to go through all this for nothing. Within just a few sessions, I was able to calm down the nerves. We gave him some icing instructions at home. We did chiropractic adjustments and started him on spinal decompression therapy. This was almost an immediate response. Like as soon as he started to feel that space open up, the pressure started to relieve. Pain that was shooting all the way down his leg was now just to his knee. After a few sessions, it was just to his hip. And after a few more sessions, it was just in his back. We do re-examinations every 12 visits. On his first re-examination, he was 75% better, already feeling much better and starting to do more and more activities. At the end of his initial care plan, where we do a follow-up x-ray, we could see tons of changes on his pelvis and how his alignment was, but his pain was like a distant memory. He was back doing all his normal activities. He still returns to see me from time to time just to continue to support and maintain that spine, but he has not had sciatica in years. Thomas's story is just one example of what's possible when sciatica is treated at the root cause using a multimodal approach like the one I walked you through today. Chronic sciatica leg pain can feel discouraging, especially if you've already tried multiple treatments without lasting relief. But this is your reminder not to lose hope. If you're dealing with ongoing sciatica, look for a chiropractor in your area who uses a similar data-driven approach that focuses on structure, disc health, and nerve healing. And if you're in the Houston, Texas area, look us up. We'd love the opportunity to help you. If you found value in this video, please like and share it with some people so that other people struggling with sciatica can find clear, reliable information. Leave a comment below and share your experience with sciatica or ask a question. I read and reply to every comment. And don't forget to subscribe if you want to learn how to take better care of your spine, prevent flare-ups, and stay pain-free with clear, actionable steps you can use right away. Now, the next video you should watch is this one, where I break down the 5 biggest mistakes that keep sciatica coming back and exactly how to avoid them. Go watch this video next.